This particular picture shows us malignant vascular lesions such as Kaposi sarcoma that can appear anywhere on the skin surface or on internal organs. These are caused by human herpes virus 8. Lesions vary in size from pinpoint to very large and may appear in a variety of shades. And then this next one is called oral hairy leukoplakia. It's an Epstein-Barr virus infection that causes painless, white raised lesions on the lateral aspect of the tongue and can occur at this phase of the infection and is another indicator of the disease progression. So for the complications, right? AIDS diagnostic criteria is actually established by the CDC. The immune system now is already severely compromised. They have infections, malignancies, wasting, and HIV-related cognitive changes. This is to show us an opportunistic disease that generally do not occur in the presence of a functioning immune system. This is called pneumocystis eryveci, which is a type of pneumonia that can appear as an opportunistic disease associated with HIV infection. So what are the diagnostic studies? Most useful screening tests detect HIV-specific antibodies and/or antigens. It may take several weeks to detect antibodies. They are performed using either blood or saliva, and a combination of tests can detect HIV earlier. For the lab, HIV progression is monitored by CD4 plus T cell counts. Both of this actually provides a marker of immune function. And then the viral load, the lower the viral load, the less active the disease. Abnormal blood tests are basically common. Resistance test can determine if a patient's HIV is resistant to drugs used for antiretroviral therapy. So we have genotype and phenotype assays. They are similar to culture and sensitivity testing used for antibiotic selection. So as part of the interprofessional care of HIV-infected patient, they are focused more on monitoring HIV disease progression and immune function, initiating and monitoring antiretroviral therapy, preventing the development of opportunistic diseases, detecting and treating opportunistic disease conditions, manage the symptoms, preventing or decreasing complications of treatment, and preventing further transmission of HIV. In order to accomplish these goals, ongoing assessment, clinician-patient interactions, and patient teaching and support are required. It is also very important to prevent or decrease the complications of therapy and prevent further transmission of HIV. For the initial patient visit, what do? We perform a complete history and physical examination. These findings will determine the patient's needs. This is also a good time to ensure that case reports required by the State Health Department have been completed. We also have to determine the need for referrals and remember that a newly diagnosed patient may not be able to retain or understand the information. So we have to be prepared to repeat and clarify information over the course of several months. So the main goals for the drug therapy will be what? Decreasing viral load, maintain or increase the CD4 plus T cell counts, prevent HIV-related symptoms and opportunistic diseases, delay the progression of the disease process, and prevent HIV transmission. So as a safety alert, many ART drugs have dangerous and potentially lethal interactions. So like for example, for the herbal therapies, it's actually is dangerous to give if they are utilizing St. John's wort. Other over-the-counter drugs that may cause interactions are antacids, proton pump inhibitors, and other supplements. So, opportunistic diseases complicate management of HIV infection. So, prevention is the preferred approach to opportunistic diseases. A number of opportunistic diseases associated with HIV can be delayed or prevented with adequate ART vaccines and disease specific prevention measures. Although it is usually not possible to eradicate opportunistic diseases once they occur, prophylactic medications can significantly decrease morbidity and mortality rates. So, for the pre exposure prophylaxis, this should be used in conjunction with other proven prevention interventions such as condoms, risk reduction counseling, and regular HIV testing. Tenofovir in combination with emtricitabine, also known as Truvada, is used to reduce the risk of HIV infection in uninfected individuals who are at significant risk of acquiring HIV. This combination is also currently used together with other antiretroviral agents for the treatment of HIV infected people. So, what will be our nursing management? So, with regards to assessment, since HIV infection can be prevented, nursing care for individuals not known to be infected with HIV should focus on preventing disease transmission. So, the first step is to assess the patient's individual risk behaviors, knowledge, and skills. Do not make assumptions about people or their behavior, and we have to assess for risky behaviors on a regular basis because things can basically change. So, for the at risk patients, right, we ask if they have ever had sexual contact with someone known to have HIV. These particular questions provide the minimum information needed in order to initiate a risk assessment. Follow up a positive response to any of these questions by an in depth exploration of issues related to the identified risk. And then, based on the assessment, nursing interventions can then encourage the patient to adopt safer, healthier, and less risky behaviors, particularly in regard to sexual intercourse, drug use, perinatal transmission, and work issues. So, specific assessments are needed for an individual who has been diagnosed with HIV infection. So, we do subjective and objective data collection. Early recognition and treatment can basically slow the progression of HIV infection and prevent new infections. A complete history and thorough systems review can help identify and address problems in a timely manner.